For our second episode of Clean Tightness, we're going to unpack the burden of anxiety. Welcome back to Tighten Mind. In our last episode, Dr. Kamal mentioned that up to 25% of our society carries the heavy burden of anxiety, yet many dismiss it as just a personality trait. Oh, he's just that way. Today, we're spending about 12 minutes breaking down what anxiety actually does to our brain and how highly treatable it is. Establishing boundaries is what we'll start with. Dr. Kamal, we all experience stress before a big presentation or a life changing event. Where does normal adaptive worry cross the line into clinical anxiety that requires professional attention?
Thank you, Ali, for giving me this opportunity. I think it is excellent question and it is valid in every disease. I think anxiety is such an important topic. As you mentioned that the prevalence rate in United States currently may be about 25%, which is one in every fourth person. Fortunately, anxiety can be of severity, mild, moderate to incapacitating, and in majority of cases, it is fortunately. Now, it is important where normalcy or physiology ends and where pathology or disease starts. Every body function is a well-defined parameter, or we are familiar with the advancement of medicine, the normal range of any body physiological function, such as blood pH. There is a range of normalcy, human heart rate, human blood pressure, of seeing, of hearing, hormonal level. So there are well-established levels for most of the physiological functions, makes us determine what is normal and what is pathological. Normally is usually defined by median, where 50% of the normal population around with one standard or deviation. Unfortunately, we have not been able to estimate or measure psychological functions. There is no scale as such where you cannot, there is no apparatus or there is no blood studies which can determine your level of depression, psychosis, and anxiety. There are multiples or tests which helps you to give a range, but that is where psychiatry was in problem before, because there was no agreement between different observers where normalcy and pathology begins. In particularly about anxiety, anxiety is a normal human psychological function which actually helps promote our functioning. And we are all familiar with that bell-shaped curve where anxiety is plotted against performance, and your performance increases as the anxiety increases. But after a certain level, as your anxiety increases, your performance goes down. Now, anxiety, if you open any dictionary, is defined as fear of unknown. It is opposed to being afraid of something, like you see a lion or animal, a dangerous animal, and you are fearful, which is a normal psychological reaction. But when disappears or the danger disappears, you go back to the relaxation phase. Now, there are different well-defined, recognized patterns of anxiety which is manifested as disease in humans, like a number of diseases on anxiety spectrum disorder, such as generalized anxiety disorder. And there are certain criterias which needs to be met for every diagnosis. As you know, psychiatry and mental health, it is the DSM manual, which is our reference standard book. So in generalized anxiety disorder, the sufferer is anxious all the time, is unable to relax, is unable to perform well, and it is prevalent. That is why it is called generalized anxiety disorder, as opposed to panic attack. which is also a form of anxiety, but it is an intense form of anxiety, which is time limited usually. It appears suddenly and it incapacitates you. And most of the people think that they are having a heart attack. So we have generalized anxiety disorder, we have panic attacks, we have different type of phobias or fears which should be excessive, like for example fear of height, fear of closed space, claustrophobia, and all these things are very common actually in our society. So there are social phobias where a person is unable to give a speech or a talk or does poorly in an interview situation. So there is OCD, and OCD was previously classified in anxiety spectrum disorder, but now it is also considered as impulse control problem. But OCD is very common and it causes a lot of human suffering. Fortunately for all these, there are treatment available. Since we don't have many tools to measure psychological function, the experience of a clinician is really helpful. And there is a saying, as I mentioned once before, surgeon from Calcutta, K.K. Das, wrote in his book, "The eyes don't see what the brain does not knows." In case, it's a sort of a deductive work, and you have to all the red flags, and therefore collecting information is the basic tool of psychiatrists. And you need to take a very detailed history from the childbirth to the age patient is, and collateral information from family, friends, past medical record. All these things are very, very important.
Let's move on to our next segment, the path to
Sure.
reclaiming potential. In this segment, we'll focus on actionable hope. Dr. Kamal, you mentioned in our first chat that the treatment of anxiety is incredibly successful for us tired of being pulled down by constant worry. What does an effective modern treatment plan look like?
I think it is a very important question. And I want to emphasize that medications are our friends, they are not enemies. Medications are not candies. You don't take them for fun. But I see a lot of people, because of some confusion, fear, ignorance, want to take medication. Sometimes they think that it is a sort of a moral weakness or admitting failure in life. But I always tell them that modern medicine is a part of modern science, and we don't hesitate to use medication for any other reasons, for blood pressure, for heart failure. So why do we have a stigma or prejudice against taking medication for psychiatric reasons? We only live once. We need to live a fulfilling, meaningful life, a happy life, and be in good relationship and in work situation and all those things. And if the medications are helpful, so be it. Now, besides medication, there are other treatment as well, which I will talk about. Now, your question that how do you decide that it needs to be treated or it doesn't needs to be treated? Now, first of all, if somebody feels or somebody is told by friends and family that you need help, that is a red flag saying that you need help. Now, to understand that there is no body organ which is called mind or psychology. So the origin of every psychological function is brain, and increased anxiety or depression, all these are manifestation of malfunctioning of that organ. So said that there are very effective medications available, which determines in psychiatry, which is very important to recommend treatment, is the level of functioning. How are you functioning at the present time? You may have depression, But if you are able to play tennis for 2 days, for 2 hours every day, then probably you don't need medication. So, one way which indicates is the level of day to day functioning. How are they functioning? How is their relationship going? So, psychiatric symptoms are part of normal human psychology. It is important to understand that when any body organ or system becomes sick, it manifests in two ways. Either it works more than normally or it works less than normally, because if it is working normally, then it is normally functioning. So you see high blood pressure, you see diarrhea, you see constipation, you see high anxiety, or you see catatonia, where a person is almost frozen. So every body illness is manifested in two ways. Either it works more or it works less. So in anxiety, when you are deciding or recommending treatment, you need to assess the functioning of that person.
Well, now we've come to our final segment, the Titan Habit. To wrap up today's bite sized episode, what is one immediate micro habit or grounding technique a Titan Mind listener can practice the next time they feel an unexpected wave of anxiety hit?
Very loaded question. And a lot of anxiety is related to how you view life. A lot of person who are peaceful, because they have accepted the life as it is. So one thing I would like to recommend is that don't take life very seriously. Everything passes. But at the same time, there are some effective tools like deep breathing exercises, relaxation techniques. You can always Google or find out how it is, effective. You were saying something.
No, I was just deep breathing.
That's a good one. If people show interest, medication, we can make a whole episode, treatment or different modes of treatment for
Absolutely.
anxiety, including deep breathing exercise, cognitive behavioral therapy, biofeedback, different types of medication, and some of the medications used for other things as well. Like there are some blood pressure medication, propranolol, which is a beta blocker, very effective in anxiety. And as I mentioned, there are different types of anxiety, and therefore you strategize different, treating different. And there are people who are not willing to take medication every day. They would come to you and say, we want something which we can use on as needed basis. So we can talk much more about it. One thing I want to tell you in brief is that how deep breathing exercise works. Like and fire, they are two diametrically opposite things. You can't put them in container. Either one will prevail or the other. Similarly, if you consider our body as a container, then you can't have anxiety and relaxation together. So if you learn how to be more relaxed, then there is not much space left for anxiety, and anxiety has to leave your body because there is not much space. So if you learn how to do deep breathing, it can be sometimes so effective that you may even fall asleep. Besides that, anxiety also has existential issues. Is basically related to survival, and the question of your death and other things are also very important. So you have to train yourself to be understanding of human role in this world, and to be at peace with the concept of death itself. That you have accepted it, I think you will find your life more meaningful and more acceptable.
Thank you very much, Dr. Kamal, for your insights. And please tell your friends about Titan Minds, and please ask questions in the comments below and give us suggestions on what topics you want us to address. Thank you.